Still a couple of minutes until 9 o'clock, correct?
Yes.
Good morning, everyone. It's 9 o'clock, and welcome all of you to the April meeting of the Kansas Children's Cabinet and Trust Fund. We do have a quorum of voting members, so we will proceed at this time. One important update to the agenda as it was printed and sent out. It omitted on the agenda state agency updates. Those are important. We do want to include those today, but we are going to remain somewhat flexible as to when we address those. So probably about halfway through the agenda, we will pivot and go to the updates. But we'll just play that by ear depending on how rapidly we make it through the agenda. So with that, we will move on to approval of the February minutes of the February meeting. They have been mailed out. You've had a chance to review them. They are fairly lengthy, but I would entertain a motion to approve the minutes.
This is Monica. I so move.
Is there a second to the motion?
This is Leetta. Second.
All right, thank you. All those in favor, say aye.
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 Opposed, no. Motion carried and the minutes are adopted or approved. Next item is the ECBG recommendations. Christy Wyckoff from Early Childhood, the Early Childhood Coordinator, will update us on that. Christy?
Morning, everybody. I am just going to go over some of the approach that we took for fiscal year 25 and go over the recommendations that you all made in June, October, December, and June. The recommendation was to continue the CIF programs at the same funding level they were awarded this current year that we're in, fiscal year 24. And then in October, it was recommended to do renewal applications. So only the current grantees that were funded in fiscal year 24 were invited to apply for grant funds for fiscal year 25. And that was just to, there was a couple of new startups that we wanted to make sure that they were stable and with their funding and their programs going forward that we funded in fiscal year 24. So we wanted to help them continue in 25, and then also just more efficiencies and for the submission and the review process for the grantees. And then in December, the cabinet annual report was reviewed, and we rediscussed what was discussed in June of 2023. We've also provided technical assistance for all the grantees during the year for evaluation. We do the evaluation presentations as site visits with Dr. Schrefferman from Wichita State, and then also data coaching and DAISY support are also given. So this is, I think, one of 2 pages. Since we have 26, it's hard to get them all on one slide. But you were all given a summary document in your materials for today's meeting. I think Dioga sent those out earlier this week, or maybe last week, with that summarizes each of our grantees in the projects they're doing. Most of them, this is the same funding that they presented here that they currently have for fiscal year 24. So nothing has changed. It's still the 22.8 million total. And like I said, you were given the materials with the summaries of their projects in your materials. So I can take any questions over this. I have some highlights written down if you want me to go over those, but maybe start with questions first, what you really want to know.
All right, thank you, Christy. Any questions for Christy? Any perspective on the update for funding recommendations?
Mr. Chair, this is Monica.
Okay, go ahead.
I have no questions, but I would like it noted that I will be abstaining from this vote.
Very well. Further questions or remarks?
Christy, do you want to hit a couple highlights before we move to a vote?
Sure.
Just briefly.
Sure. Yeah. So there's 26 grantees, and they are operating about 115 different programs in their within their projects. There was only so out of all those programs, there's only about 11 that they had made some adjustments on their application for this year. They had stated that they're going to make they're pivoting, which I appreciate, because if something isn't working quite like they like, just a little adjustment to hopefully make that better for the families and the children they're serving is always positive in my mind. There's 63 counties being served out of the 105 in Kansas, and there's 3 new programs. So out of the 115, 3 of them are new for this year, and only
new last year. We're continuing, right?
Right. Well, yes, or they added, like, instead of doing, maybe they switched the curriculum or something for this year.
Yeah, I just want to be clear. The grantees this is the slate from last year. We've worked with them and adjusted project plans appropriately. Yep. So correct. That there are some new components of things. I would just add the USDs that you see on here do not receive the Kansas preschool pilot funding. So we have been working very closely with KSDE over the last several years to sort out and avoid duplication of effort and make sure that all available resources within the context of K-12 funding is first applied for their preschool and pre-K programs before our grant funding comes into play. So we have really made sure to clean all of that up between the 2 entities. So just noting that.
Okay, thank you. Further comments? Seeing none, we will proceed to a vote. I believe we'll do this by roll call. John Wilson?
But yes. We need a motion.
Oh,
we do need a motion, yes.
This is John Wilson. I move that we approve the FY25 ECBG slate of applicants and funding recommendations.
Thank you. Do I hear a second?
Deanne Graham, I'll second.
All right, thank you, Deanne. Motion's been made and seconded to approve the funding recommendations. John Wilson?
Yes.
Dr. Tyler Smith,
Yes.
Terry Rice,
Terry's not on the call, I don't think.
okay. Monica Renan, abstain. Deanne Owen Graham,
Yes.
Leetta Felter,
Yes.
Senator Renee Erickson.
She does not appear to be with us.
She may be busy today.
Yeah, we'll talk about that.
And Chair Don Heineman votes yes. Motion
get-
carried.
Did we get
No.
Delise?
Oh, Delise Hofen.
Yes.
All right, motion carried. Thank you all. Okay, next item is the CB cap recommendations or update for fiscal year 25. Christy Wyckoff and Melissa.
Yeah, Chris, so I'll begin. Lindsay, can you go to the next slide? Within the CB-CAP, the Community-Based Child Abuse Prevention Grant Funding, it's a federal grant award that follows the federal fiscal year. So those awards, the funding cycle is October 1st through September 30th. We get annual 1-year grant awards. It's not a huge amount of money, but it is essential for a lot funding the prevention efforts that we see such good results from across our portfolio. In 2020, there was the timing is a little strange. The CRISA funding, there was pandemic relief funding. We had a supplemental award provided. The total was 2.3 million. You see the numbers on the screen. They backdated allowable timing for use of the funds to October 1st, 2020. We are allowed to spend it through September 30th of 2025. We had made awards in August 6th of 2021. Those projects, we're looking forward to bringing you some reporting once projects wrap up on some of the efforts that we have funded with those supplemental pandemic relief funds. We had a grantee that ended up having delays in staffing their project, and upshot is we recouped $134,485. What we would like to recommend is that you approve us to allocate that remainder from the CB-CAP Pandemic Relief Supplemental to help fund our annual costs for supporting 1-800-Children, which is a resource that is supported by our 4 state agencies, DCF, KSDE, KDHE, and the cabinet all have helped come together to update this resource, which is managed by Kansas Children's Service League. It has been a 1-800 telephone number to call for resource information and get questions answered, get, information about where to find certain services, that kind of thing. It's a parent resource line, considered a warm line, a helpline, not a hotline for crisis. The phone number has operated, KCSL has had this since 1993. What we did a number of years ago with our preschool development grant funding was enhance the resources to create an online website and a mobile app to give people different avenues for accessing information. So we have been supporting this with PDG funding. We, a year ago, began thinking about our sustainability planning, and this is one of the projects that our infrastructure line item will be contributing to support, and each of our partner agencies are finding ways to help us fund this out of different federal funding resources whose criteria this meets. So we just want to use this money the simplest way possible to exhaust this federal grant. It's not going to recur. So we don't want to put this into a project that then, we have created a sustainability issue for someone out there. This just feels like, let's spend it down towards the new contract year for 1-800-Children. So that is the request, and I would be happy to entertain any questions before you all entertain whether you would like to make a motion.
Melissa,
Melissa,
can you again just repeat what the recoup funds and how they were recouped and what was the reason for that?
We
missed
we use this supplemental funding to pilot preventive legal services in 3 regions in the state. And what that means is helping families that have typical legal problems that when you have the ability to engage an attorney, you take care of. If you get if you are having a dispute with a landlord, or you have issues with traffic violations, we know most of us know how to navigate the legal system and address those issues and engage representation and deal with the legal problem so that it doesn't mushroom into a bigger crisis. But some families don't have the ability to go get an attorney to represent them, to help fix those issues before they get evicted, or whatever the crisis might become if they ignore or otherwise cannot address the simple root cause. So we've been working with Kansas Holistic Defenders, Kansas Legal Services. We've had these grants going on to fund this program, and the point of this is to help families cope so that things don't escalate into crisis mode, which is when children end up getting removed from homes into foster care because, whatever the crisis may be. So we've been helping fund these services, and our research team will be bringing reporting back to you on the impact that these pilot programs have had. That said, one of the grantees had they could not attract the personnel to actually complete the work of their grant. So the money ended up left on the table, so to speak, and we came to mutual agreement that we would recoup that funding from them, and here we are. So it's just one of those things. I know our judicial system has been, I know our Chief Justice has focused on the difficulty of getting legal help in rural Kansas, and this is really emblematic of the issues that the court system has been shining some light on. So we too saw the problem was engaging the attorneys needed to provide these services. So that is the reason for the recoupment. It was with the we worked hand in hand with the grantee over this several years, trying to help them figure it out. We just ultimately made the mutual decision to bring this money back for reallocation.
Okay, Melissa, 2-part question. How do families become aware of 1-800-Children? And number 2, what's the volume of traffic through that phone number?
We do have data on it. I don't know that I am equipped at my fingertips to respond to that question, but so I'm going to put this out there for our friends at KU. If you could drop an email in my inbox while we're talking, I certainly can pass along that information. But the call line doesn't get near as much traffic as the newer resources. The mobile app and the website have high traffic, like tens of thousands of hits on those resources. every year, a major uptick in utilization rates. So we are really pleased with the usage, and we collectively across the 4 agencies have been attempting to publicize and share this as a resource. So in our All In for Kansas Kids communications and suite, our toolkit, it's posted, it's cross-referenced and linked on various websites and included in all of our communications. Kansas Children's Service League also helps promote it. So we just try and make sure that in the kinds of resources that families receive, that this is noted as a resource they can access. There's no cost. It's just out there and available.
Okay, good. Thank you. Further questions for Melissa regarding CB-CAP funding recommendation? Seeing none, I would entertain a motion to approve.
This is Monica. I'll make that motion.
Thank you, Monica. Do I hear a second?
This is Leetta. I'll second.
Thank you, Leetta. Motion has been made and seconded to approve staff recommendations regarding the remaining CB-CAP funding. John Wilson,
Yes.
Dr. Tyler Smith,
Yes.
Monica Renan,
Yes.
Delise Hofen,
Yes.
Deanne Owen Graham,
Yeah.
Leetta Felter,
Yes.
and Chair Don Heineman. Yes. The motion carries. The recommendation is approved.
Great.
All right, next up is,
Christy
Melissa?
with an update.
okay, thank you, Christy.
Hello again. I just wanted to go over the timeline for fiscal year. So this is federal fiscal year 2025 for annual CB-CAP funding. So not the pandemic relief funding that Melissa was just talking about, but our annual CB-CAP funding. So we plan to do a competitive grant application that will open on the Kansas Common App portal in mid-May through June 28th, 2024. And then we will do an initial review in-house the 1st through the 5th of July. And then eligible applications will be reviewed by an external panel for the next 2 weeks. And then July 22nd through the 26th, we will review the scored applications from our external reviewers and bring that to a vote for you all on August 2nd cabinet meeting. And just a reminder that any awards that are approved by the cabinet in August, they are dependent on the U.S. congressional budget, and then our federal award notice that we will receive, and we normally receive that in September after you guys. So that's kind of how that funky timeline works with us receiving our award and you all voting on our proposals. And then the grant year will be October 1, 2024 through September 30th, 2025. So just 1 year awards.
All right, thank you, Christy. Any questions about her presentation, laying out the timeline for the RFP, and the action point for us would be at our August meeting. Any questions? All right, seeing none, thank you, Christy.
Thank you.
We'll move ahead now. Melissa, do you want to go with the needs assessment now?
Yep, let's do
Okay.
that.
All right.
At our February meeting, we did a deeper dive into the 2024 Comprehensive Early Childhood Needs Assessment. We noted at the time, we noted there were still, we were proofreading and making sure that all the technical edits were completed. And a few of you indicated a desire to take a deep dive into it. And so we deferred any action on it until this meeting, just to open up some space and time for folks to get back to us. I'm happy to report that nobody had any substantial changes. There were lots of compliments and you know, people noted the breadth of the involvement, you know, out with our outside partners and the public in terms of gathering the data for the needs assessment, but nobody requested any changes. The KU-CPPR team completed the technical review of the document and made just the copy edits and formatting updates that were needed. There was one clarification that we realized we needed to make. We had written about a project happening in Cowley County as a pilot program. They have experienced some difficulty getting it off the ground. So we have shifted, we still have it noted, but it is noted as something that they are exploring rather than something they are actively piloting, so that we are accurate and do not give the impression that this is a project that's happening. So that is the only change of content, substance that we've made. And with that in mind, we would appreciate the Children's Cabinet in its role as the Early Childhood Advisory Council to accept the needs assessment formally as final and ready for us to turn in to our federal project officer for preschool development grants and as a grant deliverable. And then you know, share it publicly and put it out in the world as a complete asset that can be accessed when people need the information it contains.
All right, thank you, Melissa. We did spend some time on this in our February meeting. So it's not new subject matter to us. But I'll open it up to the board for any input or questions before we proceed to a vote. Any questions? Seeing none, I would entertain a motion to approve.
This is Lietta. I move to approve.
Thank you, Lietta. Do I hear a second?
Yeah, and I'll second.
Thank you, Deanne. Motion has been made and seconded to approve the PDG needs assessment as presented by the staff. All those, this will be a roll call vote. Now, actually, this one we only need a voice vote. Pardon me. So all those in favor signify by saying aye.
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 Opposed, say no. Motion carried and the assessment recommendations have been approved.
Great, thank you. The next step will be to bring you the strategic plan. We'll talk a little bit about that when we get to my director's update, but I think this would be a great time, Mr. Chair, to add the agency updates into the mix.
All right, thank you, Melissa. Don't see on my screen who would be first up. Do you have some? There we go. Derek and Jesse from KDHE. Do you have an update for us?
I do. Thank you, Mr. Chair. Thanks, Melissa. Hi, guys. I'm Derek Furlong. I'm one of the Bureau Directors for Family Health at KDHE. I'd be remiss if I didn't wish my daughter a happy 5th birthday. Brenda turns 5 today, and she also has kindergarten roundup and may or may not be directly to my right. So if you see a little blonde head peek in, that's just her. Did want to update the cabinet this morning because we've had a lot of changes, I think, or a lot of updates, I should say, since the last meeting, and then really in the last month as well. So just as a refresher on our regulation work. There you go. Thank you so much. So we have been working since about last March or April was when we formally began to our regulatory review for childcare licensing. And we worked really diligently, really hard. As you guys know, regulatory reviews can take several years. We have some agencies, I think, that have had regulations kind of in review for maybe nearly a decade, if I'm not mistaken. So on our end, a 6-month turnaround is pretty darn swift. We finished our review in September. We got the final Department of Administration stamped regulations to the Office of the Attorney General in October. We did engage with them a couple of different times, once in December, and then they had a few suggested edits, had a couple of questions, and we provided all of that virtually same day. And then we submitted back to them in January. They had another follow-up meeting for us here just a little more than a couple weeks ago now. The timeline's kind of foggy since session's been going on, but had another meeting with them and luckily got our final stamp from them, and we're able to enter the next part of the promulgation process, which is publishing in the Kansas Register the notice of public hearing. So that was published on March 28th, and we do have a public hearing scheduled for June 4th at 9 a.m. in Memorial Hall, and that's here in Topeka. The 60-day timeline between publish in the Kansas Register on March 28th and that public hearing is the public comment period. And then, of course, as you can see on the screen there, we do encourage people to submit their written comments prior to that day to Allison Dalrymple, who's actually on the call with us today, but she's our Deputy Bureau Director and also our Administration and Policy Director for the Bureau of Family Health. We have an online submission form. This is all posted on our website, and it's kdhe.ks.gov/kidsnet, KIDSNET. And if you go there, it should be front and center, and we'll take you to that. We've also posted a graphic that we had created that kind of explains the process of regulation review. I do want to point out there was some legislation, I believe it was last year, 77-440, that requires state agencies to review their regulations every 5 years. So just kind of keep that noted. We're talking about reviewing regulations and the work that goes into that. And there's really nothing that, requires specific timelines in terms of how quickly agencies have to work through the regs they're reviewing, but they do have to review them every 5 years. So I think just a reminder that we've, engaged in this work this year. Our 5-year timeline is actually this year anyways. And then, we'll continue to review these. So I've always wanted to keep ensuring mostly our providers, but our elected officials as well and partners that this isn't a one-time thing. We're reviewing these. We needed to update these. We absolutely acknowledge that. We were very intentful with our engagement with our provider community and with our partners and our child care systems improvement team, getting feedback directly from them and actually having them draft some of the language alongside of us. We engaged other interested, partners like the Kansas Breastfeeding Coalition for feedback. Just a lot of strong feedback from subject matter experts, early childhood experts, as well as the Federal Office of Child Care. We pass all of our proposed language off to them as well, just to essentially say, hey, is this going to be okay? Because as a reminder, childcare that is not licensed, there's some exemptions to this, but is for the most part not eligible for child care assistance. So just a good reminder that generally you have to be a licensed provider to be able to access that to assist Kansas families and children. So all of that being said, we're really excited about moving forward with our regulatory changes. If you look at the timeline, obviously with a public hearing on June 4th, kind of what happens from there, and what we've been saying publicly is we hope everything goes off without a hitch, and we've done all of our due diligence ahead of time. Of course, absolutely encouraging comments, if there are any to be made. We're actually required to respond to each and every comment. So we have to provide that back once we get the comments. Then again, assuming everything goes off without a hitch, because there's never anything that pops up that's unplanned, or any issues whatsoever. But assuming everything goes perfect, we actually have to turn around and publish those in the Kansas Register again, and then regulations become effective 15 days after that published date. So I think we're really, really hoping for July, early July. Our plan right now, assuming all of the comments are generally positive and we do not need to make any changes or edits, that we would turn those around very, very quickly. Very quickly. We've already had those discussions internally. This is something we want to get going, because again, our providers, they make business plans based off of some of this for the upcoming year. We're in that time of year where they're looking ahead to next school year. We've got school age kids, summer camps and programs that are getting ready to get up and going and are planning as well. So it's a lot deeper. There's much more work below the surface than people may realize. And I'll also mention too, anytime we make regulatory changes or program changes for that matter, we actually have to change that in our system, in our licensing system. And something that we found out about our licensing system, which is outdated and antiquated, and we are very happy to be working on a new one. But the current one, we have to put all of our changes into a test environment. And you may think in modern databases and modern systems, you can take your test environment and then click go live, or click active and it goes active. Our system does not do that. We have to recreate the entire test environment as we've already done it. So we're essentially having to do the same work twice. That's just a part of the system. It is what it is. We make it work. So our team is, I won't say they're excited about that part, but up for the challenge, as we have been this entire time. So I think on that note, Melissa, I will pause for any feedback or questions or any ways I can provide clarity. Like I said, Allison's on the call with me, and she's very, very familiar with this process too. So in the event that I can't answer something, maybe she can.
Derek, this is John. I just wanted to say I appreciate the work that you and your team have done over the last year to engage the provider community, to get that professional expertise reflected in the updated regulations. I think this is the way that government should operate, is listening to those most directly impacted by things. And I think you all have done a stellar job. And then I've also seen you kind of up close during the legislative session, as you've been so responsive to lawmaker questions about how licensing works or what the regulatory process is like. And so to your whole team, thank you for doing that. It's really noticeable. And then also, I think I know the answer to this question, but I would love for you to confirm it. If there are ever statutory changes, so things in law that people are unhappy with, whether they're current law or they're soon to become current law, they don't take that up through KDHE. If there are statutory changes, we have to go through the legislative process and lawmakers, correct?
Correct.
Okay, great.
Correct. And thank you for the nice comments, John.
Yeah.
Mr. Chair, this is Monica.
Go ahead, Monica.
Derek, I agree with everything John said. The assumption that any change in childcare regulations is easy is a bad assumption, and that the voices of the childcare providers that you have sought and taken into consideration should continue to be listened to. Your job is safety and health, and to think that changes can be made easily and through a short meeting, again, is a bad assumption. So thank you for sticking close as those decisions are being made in this session, as they continue to be. And I'll just say it again, if there's a statutory change, you need to contact your legislator and not KDH&E.
Thank you, Monica.
All right, thank you, cabinet members, for your input. Any further questions or remarks? If not, thank you, Derek. Is that the sum total of your presentation?
Yes, I don't think I have anything additional. I know Jessie Piper is my co-director. She actually had a first 1,000 days presentation this morning with the Kansas Breastfeeding Coalition, and she was opposite of Representative Sharice Davids. So I'm not sure if she's on to give.
I see her in the
Oh,
queue.
okay.
Yeah.
Awesome.
Happy birthday, Brendolyn, and happy kindergarten roundup.
Thank you.
Hi, everyone. I just jumped on, so I heard my name and I don't know what you need from me, but happy to provide an update or if that's where we're at.
Yeah.
Okay. I would say there's kind of a lot going on in the McV world right now. Dion Guyton, our program director for McV, took a voluntary move to a fiscal position in the program and really wanted to play up his strengths, which are financial stuff like that. So Amy Dean Campmeyer is providing direction for the program as interim. She oversees the Children and Families section director. So they've been working heavily with Janet Horace, a consultant from Iowa, with McV. And we just had kind of some brainstorming all day yesterday around what we can do with McV dollars that we're getting federally, talking about some expansion efforts and some capacity building efforts, maybe some pilots with the extra funds. So really excited about the direction we're moving with McV. I think Part C, Infant Toddler Services, is working on starting the site visit this year. So OSEP, Tricia is presenting to OSEP today, and then we expect them on site with us in September. So I didn't know how rigorous the site visit with Part C was, but apparently it's a 6-month long rigorous process. So we're doing a lot there. Yeah, I would say making some considerations around how McV connects to universal home visiting. I guess I should have mentioned that earlier as well, and how we can try to connect the dots there a little bit more with central intake and referral systems, stuff like that. So yeah, lots of exciting stuff, all good stuff on my side. So I think that's about it.
All right, thank you, Jesse. Cabinet members, any questions or input for Jesse?
If there are no questions, Mr. Chair, can I add a couple of additional comments that I may have forgot about? The first one, and I'll let maybe Carla touch on this if she's available, but on our end, we do have the Office of Child Care that's doing our federal monitoring visit. So we get kind of been telling our locals, we get a little taste of our own medicine as far as surveys and your federal site visit goes. So we will be engaging, of course, DCF is the state lead for that, but we get to attend with them next week. So we are, dare I say, excited, Carla, about that? I don't know. So just we have that. And then I do want to mention, didn't really want to end our update with this, but I do want to mention Suzanne Lewis. We had a staff member in WIC that unexpectedly passed away. And I just wanted to mention that we're thinking of her and her family and friends and grateful for the work that she put in for the last year with our WIC program. She was very connected here in the Topeka community as well, and just wanted to publicly acknowledge her and thank her and give our thoughts and prayers to her and her family and friends.
All right, thank you, Derek, for that update and that unfortunate information, and our thoughts are with those who knew her. Moving ahead, next will be Department of Corrections, Matthew Billinger and Gloria Geither. Matt?
Yeah, thank you. And actually, I asked Gloria to join us today, but I told her we probably wouldn't be ready for it till 10 o'clock. So I did message her that we'd be ready early. Could we possibly come back to us?
Sure, we'll skip over you and come back.
She's actually in the meeting.
Oh, I'm sorry. I didn't see her.
Yeah.
I see her now.
Yeah.
So other Department of Corrections, I wanted to touch on a follow up on with you a few items we have talked about before. Juvenile Services is engaging in a family engagement training that kicks off next week on Monday. And this is really training our supervision officers about how to engage and get more involvement from families for those youth that are on supervision. So really excited about that. One of the big ones we had was giving more information about the process, educating those families about what happens in court and what to expect during that supervision process. So that kicks off on Monday. We're really excited about that. The supervision agencies were really asking for more training about how to work with the families of that. And also part of that process, we updated the standards for juvenile supervision. So those went out recently, and those are kind of like policies for supervision agencies, directing them about best practices and goals and stuff like that. At our last meeting, we talked about a few pieces of legislation that we're going through. So I wanted to kind of update you on those if you hadn't seen that. We talked about the nursing nursery at the Topeka Correctional Facility. You had some questions about that. That did get a lot of conversation in the legislators, but they also had a lot of questions and wanted to get a little bit more details. So I saw that it came up, I think, last week as a discussion in the interim. So while I don't think there's going to be any legislation passed on that this year, I think that's going to be an ongoing conversation to possibly have some positive movement next session. Same with the juvenile correctional facility, allowing youth to leave the correctional facility for programs and education. Kind of similar idea. They wanted more details and information, so that kind of got pushed aside, and then we think that'll come back again in the next sessions. The Juvenile Justice Oversight Committee is putting a lot of focus this year. You know, a lot of topics going on, but some of the more focus is around behavioral health. There is a work group on that. They kind of came to the decision that, you know, weren't sure if the state or the system could support new programs or new initiatives. So we're working to support some already existing stuff. And actually, Kansas Service League and 1-800-CHILDREN are coming to our next meeting to give a presentation, and we're going to engage in some conversation with them about helping keep their system robust and any more we can do about that. Another topic is our juvenile defense system in Kansas, trying to get a little bit more stability in that. And also kind of, we're hoping to create like a centralized, either an agency or kind of fit into an already existing agency to provide a little bit more oversight and support for those juvenile defense personnel. I'll pause there before I introduce Gloria to you. If you have any questions about those topics, I'd be happy to answer them for you. No? Okay. So I asked our Deputy Secretary of Facility Management, Gloria Geither, to come be here today. She is a great resource to us and recently appointed her position. I guess maybe it has been a little while. But one of the things that they're working with of those facilities is to bring in children of those incarcerated, and they kind of paired up with the Kansas Discovery Center, one of my kids' favorite place to go. So we wanted to get a little more information about that, and since that's not something that I'm super involved in, we asked Gloria to be with us. So I'd love to pass that baton on to Gloria, and she's going to give you a little bit more detailed information about that.
Thanks, Matt. Thank you, everybody, for inviting me here today. I also on the line is Danae Mosier. She's the executive director of the Children's Discovery Center. So I asked her to join in case there's more specific questions that you have. But as Matt said, my name is Gloria Geither. I'm the Deputy Secretary of Facility Management for the Kansas Department of Corrections. I'm also the former warden at the Topeka Correctional Facility. Just a little background, when I first started my career in 1990, my job was to create a program for moms and their kids that we called the Women's Activities and Learning Center, and that was in 1990. The concept of that program was so that moms and their children could build their relationship and enhance the relationship while during their incarceration and stuff, and help and maintain and enhance that relationship as she was incarcerated. So that was in 1990, and here we jumped to today, and it's kind of funny how your career kind of follows you a little bit. But So the Children's Discovery Center in 2018 also came on board with the Women's Activities and Learning Center at the women's prison. For those of you, Topekans or whatever, that Topeka is the only female prison in the state. So we started that program in 2018, and to say that was groundbreaking and innovative moment may not seem big to others, but it's huge in corrections because we don't typically blend those two worlds. And when we do, it's security minded. You come to if a child comes to the prison with their caregiver, they're sitting across from a cold table, meeting table across from one another, not much interaction because you got to keep your space. There's not any toys or reading opportunities, anything else like that to have with one another, especially hugging and bonding moments. So anyway, so in 2018, Children's Discovery Center came to TCF and started working with us there. Last year, because of the results of that program, the Secretary of Corrections, Secretary Zamuda, invited all the wardens in the state to go to the Children's Discovery Center so we could watch the residents' interaction, the Topeka women interaction with the children. However, very smart guy, I always tell him big brain, smart guy, didn't tell the wardens what they were going to experience. So he and I could watch the wardens' reactions and how they are to the program and to see if they could, what their thoughts were afterwards. So they had no idea why they were there or what they were visiting because they weren't from Topeka. But to watch them and hear what the comments they had to say after seeing the moms and the children's interactions and to feel that experience themselves, even for some of them to participate with some of those moms and their children. Afterwards, they never asked why we're there. What did you want us to do or anything? The first thing they said is, how can the men do this too? And so this year in January was the first time that we piloted the program to men and young adults in our system. The collaboration between the department and, advocates for children to help maintain and build those relationships with residents and their children, to see that go all the way through even to the men is just, words can't explain that. I mean, you see residents for who they are, which are, they're somebody's child and they're also somebody's dad and somebody's brother. And so to watch and try to help maintain those relationships together so that child doesn't become a statistic as well is extremely important to me personally and to the department. But I don't want to share my experiences and stuff. So I'll ask Danae if she has anything she'd like to share about her experience with working with the men incarcerated as well. Danae, do you have anything you'd like to add?
Sure. It's been an incredible privilege, and it does seem counterintuitive that a children's museum would be partnering so closely with Department of Corrections, but ultimately we feel like everything should begin with the child, and so we have centered our programming around children and what their needs are. Department of Corrections has been very generous and willing to look at this from a different angle and working outside of the box with us. In every one of these instances, whether it's been with the 1,300 participants we've served through the women's facility or the pilots we've now done with fathers, also at the juvenile correctional facility, we have had plainclothes officers. So we have tried to create a normalizing experience that allows these children who are suffering from this separation to have the same experience that any other child that comes into the museum would have. When we're traveling around the state, we go in and we set up our mobile museum inside of community-based settings. So when children walk in, all they see is parents and children playing. The expansion of this that has allowed us to go into the juvenile facility, and we are very hopeful that at some point that regulation will change and they will be too coming to the museum. We have just this year, we have witnessed 5 fathers meet their children for the first time as a result of this program. The caregivers, the mothers have chosen to allow their child to come and be a part of this because of that normalizing aspect, because we are making this about the children. And we know that that strengthens families. And I do think that's the place that we have in common with corrections is how do we keep families intact? How do we strengthen families? And we know that that's by doing the best thing for children. This is a program that this is the only place that's happening in the United States. The work we're doing with the incarcerated juvenile population who are young parents, as well as with the fathers who are residents of Kansas correctional facilities in a public setting, is not happening anywhere else. So what's happening here in Kansas as we celebrate children and put their needs first is unlike anything else that's happening.
I want to pipe in here. This is Melissa. There's no ask. This is just a bright spot we wanted to share with you as a board, because it's something that I have been aware of since Danae started the program in 2018 with the women's facility. It is so good for the children involved. I just wanted to bring this expansion of it to your attention as our board, and we can open it up for questions if board members have any.
This is Monica. I don't have any questions, but you just made my day. Thanks for sharing that. I had no idea. And thanks to all the staff members who pull it off, because I'm betting it's not easy.
This is Lietta. Same. Just amazing to hear. Thank you so much.
Thank you. I just want to leave you with one quick story, because I'm pretty passionate about all of this, but I'll never forget the day when, when you start seeing that children are starting to see someone in uniform that's not a threat to them and doesn't scare them. And I'll never forget this one little 4-year-old boy was at the women's prison and seeing his mom, and he was playing catch. An officer was playing catch with this 4-year-old little boy. It wasn't his assignment. It wasn't his post. He just went down there because he wanted to see the kids. And the little boy was crying when I went down there, and I asked him, I said, well, what's the matter? And he said, Kevin won't play with me anymore. And he looked at me, he was, Warden, I got to get back to work. So it's just, it just warms your heart that those, you can change and affect those children's lives so much. And just by doing something simple like showing that you care. So I just really appreciate what you all do. And I appreciate you guys letting us come and share today what's going on at the facility.
Well, thank you, Gloria. That sounds like a very positive and innovative project. We commend all of you and your team for putting it in place, as well as Danae. The thought on my mind is that there's still a need for security, and I'm sure that you addressed that properly, but you did not focus on that today. Would that be correct?
Focus on security?
Yes.
I mean, it's a great program. It's a wonderful program. We're mindful, of course, it's our primary, our mission is to protect the community, protect the residents in our care. And of course we would, that extends to anybody else that comes into our facility. So it's our priority. So it's always on the forefront.
All right. Thank you. Further remarks? Well, thank you, Matt, Gloria, and Danae for the presentation. We really appreciate it.
We will post a link to a video that gives a little more information. We'll get it on the meeting page of our website. I've got the link in, and we'll share it with the team. So thank you so much for sharing your report with us.
Thank you. Thanks for letting us be a part of it. Thank you.
Thank you.
Okay, moving ahead, Natalie McLean with the KSDE. You have a report for us.
I do. Good morning. I'm Natalie McLean with Kansas State Department of Education. I work on the early childhood team. I'm a consultant with the team, and I'm filling in for Amanda right now, who is enjoying her first little bundle of joy. I will not speak as eloquently as Amanda usually does, but I will do my best. First, I wanted to share with you a little bit about what the school districts are working on right now. It's a busy time of year. As we heard earlier, there's a lot of kindergarten roundups and preschool roundups going on right now. School districts also have the opportunity right now to work on the STAR recognition application for kindergarten readiness. These are open through May 3rd in our KSDE authenticated applications. This is a really good opportunity for districts to do a self-assessment on how they're doing with kindergarten readiness and early childhood programming in their communities, as well as an opportunity for schools to be recognized for the good work they're doing in early childhood. So schools work to look at the practices that they've got going on around kindergarten readiness and early childhood programming, and provide documentation about the self-assessment that they're doing to show what they're doing. So they can earn a gold, silver, bronze, and I believe copper medals if they're doing these excellent practices. And we found that the STAR recognition program, it's a voluntary program. Schools can choose if they want to apply for it or not. But we have found that this program is changing practices that we were hoping schools move towards. So things like providing inclusive classrooms, and all those really good practices that we want school districts to follow. So that application is open through May 3rd. I did want to give an update on our Kansas Early Learning Standards that we recently updated. Those standards are currently available on our KSDE Early Learning webpage, but we are also working on getting them printed and distributed widely across the state. We're having about 13,000 copies of the updated Kansas Early Learning Standards printed, and they are going to be mailed out to licensed childcare providers, infant toddler service providers, school district staff, and Head Start staff. We've also got some of our training partners that will have some copies of these. Everybody is waiting to get their hands on them, so we are trying to get that process moved through. We also continue our work on developing resources to go along with the standards. We've got a training course that's been developed, and registration for that course will be available through Casito on May 16th. Other resources like crosswalks, supporting documents, short video clips to show how to use the KELs are all going to be posted on a website that is also in development. And we hope to have all of this available by this summer. Also, something our schools are busy with is working on funding for next year. School districts are currently working on getting their preschool aged at risk approval forms submitted, so those programs can be approved by the Board of Education in May. So the preschool aged at risk funding sources funds all 3- and 4-year-old students at 0.5 FTE that meet one of the at-risk criteria for that program. Also, our Kansas Parents as Teachers grantees are busy getting their grants submitted for that funding source. So lots going on with our school districts. Does anybody have any questions for KSDE at this time?
Natalie, in the absence of board questions, I just want to reiterate with you, Kansas Early Learning Standards are not a condition of, they're not a requirement for licensed childcare providers. We do not condition licensing on utilizing the early learning standards, correct?
Correct. Those are just a guide to help providers, parents, teachers, anybody who wants to use those, just to kind of see what we hope for children to be able to know and do, but they are not any kind of requirement that kids have to know how to do these things before entering kindergarten or anything like that.
Thank you.
Terry Rice, I see you have your hand up.
Hi, good morning, Natalie. Just a quick question. Did you say that the STAR program was optional or required participation?
No, so the STAR recognition is completely optional. It's really like a deep self-assessment that school districts can do to see if they can be recognized for excellent practices. And there's different categories. Kindergarten readiness is one. There's also one on social emotional. There's different categories that school districts can choose to fill those out for.
Thank you.
Mm-hmm.
Further questions for Natalie? All right, seeing none. Natalie, thank you for your presentation and update. And please pass on our congratulations to Amanda.
Will do.
Yeah, very exciting news for her. I'm guessing she is going to be an excellent mother. Okay, moving ahead, Carla Whiteside-Hicks with DCF.
Right. Good morning, everyone. I'm Carla Whiteside-Hicks, Director of Economic and Employment Services for DCF, and also the co-CCDF State Administrator. So few things to touch on. Derek kind of spoiled some of my stuff here. First of all, we are continuing to work with KDHE regarding the licensing standards, trying to make sure that the proposed changes continue to align with CCDF federal requirements so that we are in compliance with those regulations. And so I think we're doing a good job in that area. We are currently working on our triennial state plan. It is due this year. So we've already reached out to community partners and other state agencies to gather the necessary information. And we are on track to finalize a draft within the next couple of weeks. We will then put an ADA compliant draft on our website and then also publish information regarding a public hearing so that we can get some feedback on the direction that we're going, and then have the opportunity to make changes as necessary and as allowed prior to submitting our plan to the Office of Child Care. As Derek mentioned, and no, Derek, I would not use excited to describe the CCDF monitoring visit, but that is taking place next week. As someone else mentioned, this process takes months. So for the last several months, we have had meetings with Office of Child Care. They've already gathered a lot of information. They've viewed our website to make sure, our child care website, to make sure that it meets the requirements for community education. They have viewed some of our financial documents and our eligibility system. So this is next week. They will be in Topeka, meeting with individuals personally and just gathering additional information to make sure that we are meeting all of the requirements of our federal grant. Let's see what else. We have several RFPs that are in various stages of completion at this point, requests for proposals. So I'll just name some of them. We do have the Kansas Early Head Start home visitation RFP, which is actually TANF funded. Then we have for CCDF, our web content and hosting, infant toddler specialist network, the workforce development RFP, the resource and referral agencies, and then Child Care Quality Improvement and Support, Kansas Early Head Start Child Care Partnership is also somewhere in that process of having some grants issued. And the final thing I would say is that some of you may have seen a news article recently regarding our 2Gen grantees. That's a TANF funded grant that we have, and we have awarded approximately $11.5 million to 10 organizations across the state, with the expectation that they are providing wraparound services for the entire family. So we see that as a really good fit for our efforts in the world of early childhood, to make sure that those grantees are not only meeting, if they traditionally would offer services only to adults, that they're also providing services or connecting families to services that would assist them with any concerns they may have with their children, so that we can truly serve the entire family and increase the opportunities for some long-term positive outcomes. Those are my updates.
All right, thank you, Carla. Cabinet, any questions or observations on Carla's presentation? All right, seeing none. Thank you again, Carla. We'll move ahead to Amy Raymond with the Kansas Supreme Court.
Good morning, everyone. I'm Amy Raymond. I'm the Chief of Trial Court Services for the Office of Judicial Administration. I'm standing in for Justice Wall this morning. The biggest update I have is, I think that I've mentioned this before and Justice Wall has, but we are within a little over a week of our 2024 Child Welfare Summit. It's our inaugural summit on this topic. We have a day and a half packed of presentations related to permanency, safety versus risk, well-being of our child welfare partners. All of our sessions are, or I should say a majority of our sessions are approved for CLE. We have over 700 people registered. Over 425 will attend in person, and the remaining will attend virtually. So we're really very excited about this inaugural event. It's what I have been referring to as a working summit. So our local district teams will put together an action plan. So they will identify opportunities for change within their counties and judicial districts, and then come up with an action plan to move the needle for our children in care. And that's my update. I'm happy to stand for any questions if anyone has.
Okay, thank you, Amy. Where will the summit take place?
Very good question. I forgot that detail. Here in Topeka at the Townsite Ballroom, which is the old Bank of America Tower at 6th and Kansas.
All right, thank you.
And the dates, Amy?
April 15th and 16th. I get so excited about content, I forget the little things. So thank you for those questions.
Okay, thank you, Amy. Are there any questions or remarks regarding Amy's presentation? Seeing none, we'll move ahead to Amy Meek, who is on staff at Kansas Children's Cabinet. Amy.
Good morning, Amy Meek. I'm the Early Childhood Director at the Cabinet. I wanted to first start off with letting everyone know it is Child Abuse Prevention Month this month, and our friends at Kansas Children's Service League coordinate a lot of those activities, both statewide and regionally. And I believe this morning they were planting the blue pinwheels over at the State House. And the weather cooperated for them to do that this morning. But so in your communities, if you see the blue pinwheels, that's a reminder that this month is Child Abuse Prevention Month, and hopefully you'll see those in your communities, and maybe hear about some of the regional activities. Kansas Children's Service League, I believe on their website, you can see if there's anything going on in your area regarding those awareness activities. We are wrapping up our preschool development implementation grant this month. It was a 3-year grant, but we were given 1 extra year to spend the funds and finish up the activities. So we're entering the final month here, and we have a final report that will be due to the feds in October, kind of summarizing all of our activities and things that we did over the last 4 years. We also submitted our preschool development planning grant annual programmatic progress report to highlight we had to answer specific questions, but it highlights our activities that took place basically all of calendar year 23. That grant starts at the very end of December 30th. So essentially December 30th through December 22 through December 30th of 23. So mainly that calendar year, and that was submitted. I think, let's see. Oh, Lindsay, if you can go to the next slide. I think I'm ready for, okay. And then I mentioned it last meeting, but it is finally here and open to apply to be on our panel for the 2024-2025 cycle that starts January or July 1st. So the application is open, and we're accepting those through May 3rd. We encourage anyone that's interested to apply or reach out if you have questions about it. Those applications after the closing date of May 3rd will be reviewed, and then membership recommendations will be presented to this cabinet for approval at the June 7th meeting. And like I said, Lindsay or Ryan would be happy to answer any questions if you have them. Anyone, we need certain representation amongst certain groups, and that's and we definitely want to encourage parents to apply, and you'll see that on our list here. But our panel is made up of local education agencies, representations of institutions of higher education in the state, local providers of early childhood education and development services. We highly encourage anyone out there that's providing those services to apply. We have representation from our Head Start agencies, and including our migrant and seasonal Head Start programs and Indian Head Start programs. And then, like I said, parents of young children that are currently receiving early childhood services from the state. We'd love to have you apply and participate on our panel for the next year. And then there's the link on the screen, but you could also go to kschildrenscabinet.org to find where you can apply for that. And that wraps up my updates.
All right, thank you, Amy. Cabinet members, any response from you?
I would just go ahead.
This is John Wilson. On that second to last bullet point of parents of young children currently receiving early childhood services, would that include like a family receiving subsidy to attend childcare, or is that more like home visiting or something like that?
Really, anyone that has a young child, birth to 5, and wants to participate, absolutely, your example would be fine to apply.
Thanks.
I was just going to note that these categories are required as a component of the federal Head Start law. The language we use to describe those categories of representation are flow from the Federal Head Start Act. So we appreciate the high interest we've seen in years past and trust that people will respond accordingly this year. We look forward to bringing you the recommendations in June.
All right, thank you. Thank you, Amy. And that brings us to director's updates. Melissa.
Thank you, Don. I will start just to reiterate the preschool development grant era of Children's Cabinet work is in its final stages. We are in the extension year for the planning grants, and you just approved the needs assessment as one of the 2 key deliverables, the second being our strategic plan, which is currently in a process where we are taking public input. So the link on the screen will be posted on it is on the website already. We really encourage people to visit the survey and share your thoughts with us so that we are sure to craft a strategic plan that is useful not just to us at the state agency level, but to our community of provider partners and parents of young children and even Kansans and other sectors that understand that childcare is a central issue for economic development and whatnot, those that care about home visiting and early education. I mean, it covers the gamut of the blueprint: healthy development, strong families, and early learning. So this is a public comment period that we opened March 4th. It will run until April 19th. We have been actively engaged in outreach and taking input already, but this is just a way for people to at their convenience click online and answer the survey. I'll circle back to Don's question about 1-800-CHILDREN. Part of our needs assessment process at surveying and information gathering, we did receive 95% of survey respondents in Kansas indicated awareness that 1-800-CHILDREN is a resource that exists. So that's really, really impressive brand awareness, and I think it speaks to the 5 decades that we have operated this tool across the state. In terms of utilization numbers, the traditional call line saw 1,078 phone calls. The new mobile app had 1,851 new downloads last year. So, once you download it, you don't show up in our statistics in terms of utilization, but that was nearly 2,000 new downloads in the past year. And the big ticket item is just the online website and database. There were 59,380 searches of that database last year. So we have seen an increase in the usage, and we've clearly have made it convenient for a busy parent to access on their timeline. You can go to a website 24/7. So, it's easier than trying to carve out time to have a phone call conversation. So I just wanted to circle back and answer those questions from earlier. The strategic plan will be a grant deliverable. We have some other activities still going on in preschool development grant. I wanted to mention the Baby Steps program is that is a program that the Patterson Family Foundation is underwriting in rural counties across the state. We opted to apply some of our preschool development planning grant funds to pilot that program in Wyandotte County in the urban core. And that is successfully recruiting and enrolling participating providers. And I want to stress, Baby Steps is a financial incentive framework for home-based licensed providers to encourage them to enroll more infants, children with special healthcare needs, perhaps non-traditional hours of care to help families with hard to access childcare. We recently have seen an expansion of that Wyandotte pilot to include Atchison County as well, which is we know an area that it could use more resources. So we are really pleased about the results that we're seeing. And again, this is the sort of pilot project that we will bring impact reporting back to you at a later date. The Dolly Parton Imagination Library, stay tuned. We may need to call a separate meeting in the month of May, maybe later May. If possible, I will try and combine an Imagination Library board meeting. We need an organizational meeting to set up our 501c3. We might opt to do that on the same day as our June meeting. We'll do a little survey of board members to see what is most preferred and convenient for all of you. But we will have the organizational meeting. The articles of incorporation have been filed with the IRS and the Secretary of State. The next step, hold the organizational meeting, adopt bylaws. We have a sequence of mandatory policies that have to be adopted. All of that is drafted and ready. We are actively working out the terms of an agreement with the Dollywood Foundation so that they are set up to serve as our fiscal agent for the nonprofit. They will set up an account that is specifically ours. They will manage it. They will issue tax forms to donors on our behalf. They will file, they'll prepare the 990s and do all the financial accounting and auditing on behalf of the Imagination Library of Kansas nonprofit. So I'm excited to share more plans. We are negotiating a couple strategic partnerships for the program that I'll share more about when they're more concrete, but it's just a source of ongoing joy because we've seen growth. July 1 enrollment in that program was about 40,000 kids. And this week, when we got our invoice, we have grown to 75,211 Kansas children are enrolled and actively receiving books through the book gifting program. That represents about 40% of eligible children, and our target for what is effectively considered full enrollment is 65%. So we started the fiscal year at about 27% of kids enrolled. We've grown to 40%. So I am confident that with the work that lies ahead in the coming year that we're going to continue to grow this program. We have story walks actively set up in 3 state parks, and we are working with the Parks Department to add a 4th in a new location this summer to be announced at the appropriate time. And I'm excited at what is in the works. So that's the Imagination Library updates. I think the next thing that we should probably carve some space for board discussion would be a little bit of a legislative update. The legislature is actively engaged in their work as we speak. It's why Senator Erickson is not with us. They are in session at the moment. The outstanding items that still affect our work here at the Children's Cabinet involve the budget. Both the House and Senate should be scheduled to debate the what we'll call the base budget bill for the state of Kansas later today. That package includes the key fund transfer language that is inside of the Department of Administration budget. And it includes our line item CIF transfers that flow through us and go to DCF and KDHE. So those will be debated and passed later today. The rest of our budget is in a separate bill that is the primary topic is K-12 public education. And that is because our MOU setup is that KSDE serves as our fiscal agent. So the 2 items that pass through the CIF and get fund that go to KSDE, Parents as Teachers, and Kansas Preschool Pilot funding and the slate of line item appropriations that constitute our funding for the Early Childhood Block Grant, the Imagination Library, our accountability process, our overhead. All of those items are part of that package by virtue of the fact that our budget is embedded in the KSDE budget. The budget bill was defeated last night in the Senate for issues that lawmakers had related to K-12 policy provisions in the budget. So they have a process that will involve a conference committee between House members and Senate members of the appropriate committees to start over to try and craft a bill that goes back through the process. I'm confident that we will end up with resolution because we have to, but you'll have to stay tuned for that process to unfold. Today is technically known as, the nickname of it is Drop Dead Day. It is the last scheduled day of the regular session. And then April 29th, they're scheduled to come back to begin the veto session. So there is still time, although time is rapidly coming to a close. But that work will get completed, and I have faith in the process. The other piece of major legislation that affects us is it's the legislation that sets up the Office of Early Childhood. Technically, it's House substitute for Senate Bill 96. That bill has gone, as you can tell from the title, has gone through multiple iterations. We are on the 3rd or 4th generation of this bill, but we finally have a product that I think represents compromise and consensus. It moved through the House last night, and it awaits a vote in the Senate. Should the Senate vote to concur, the bill the package would then move on to the governor for signature. That bill affects the cabinet in a number of ways. And I mean, the good news in the bill is the Office of Early Childhood will be authorized, and that will bring, there will be 4 divisions of this office. One will be childcare, one will be home visiting, one will be the Head Start Collaboration Office, and the 4th one will be the Children's Cabinet. So our MOU will move in. We will no longer be inside the Department of Education. It will be the Department of Administration that carries the MOU with us, so that certain basic office functions, HR and IT support, and some of the things we currently receive through KSDE, so that we don't have to staff that many staff positions, we will shift that over to Department of Administration. The bigger change is, and I will say, we are really excited about what the future holds for the realignment, the reorganization of these key programs, so that we can streamline and align and help folks navigate the system a little easier on both sides of it. The bill also made some changes, and it will affect membership of our governing board. So currently, as you all know, we have 5 of you who are appointed by the governor and 4 of you who are appointed by specific legislative leadership. So 2 members appointed by the minority leaders of the House and Senate, 1 appointed by the Speaker of the House, and 1 appointed by the President of the Senate. In the compromise plan that was worked out, we went through a couple iterations and landed back at the governor having 5 appointments. The legislative side of this grew, so we will add appointments from the majority leader of House and Senate. So 2 more people will be joining the board for a total of 11 voting members. They removed the provisions that relate to the length of your terms. So right now you are appointed and serve 4-year terms. In the new, as of July 1, should this bill take effect, the appointments will be at the pleasure of the appointing authority. So the time limit will be removed. You could potentially serve longer, terms could be shorter. It will be up to the appointing party to determine who they wish to appoint to our board. So I need to share that. And then the other structural change, right now, the governor, since inception, the governor has appointed our board chair starting July 1. So Dawn, for you specifically, you are the governor's appointee. You will, all of you will now serve at the pleasure of the person that appointed you until you are no longer the governor's appointment. You will continue to serve as our chair. But when a new chair needs to be replaced, it will be done through a vote of the governing board rather than the governor appointing. So I just want to flag those changes that are on the horizon. The transition planning involves 1 year for the Office of Early Childhood, involves 1 year under the leadership of a transition director who will be brought in as a neutral party that has not, is not coming from an existing position in our state government. It will be someone with the right portfolio of expertise in strategic planning and this kind of merger and the skill set needed to figure out staffing movement and that sort of thing. So that transition director is supposed to be named by July 1, 2024, serve for a year, coordinating the transition planning as a member of the governor's office. And then by July 1st, 2025, an executive director of the Office of Early Childhood is supposed to be named by the governor, and then that position will go through a Senate confirmation process. So that is the update. I want to open it up for board observations or questions, discussion amongst yourselves, whatever is appropriate at this time, Mr. Chair.
This is Leetta. Thank you, Melissa. May I ask a question?
Sure.
So for the chair role, would that be from within the governing body or random nominations from?
No, it would be an organizational function of the voting members of the board to come together and nominate candidates to serve as chair and take a vote and determine who will serve in that role.
Okay, and then Don, though, gets to serve his full term appointed.
Don and all of you can continue to serve until your appointing party makes a different choice. So in the past, your terms were 4-year terms. We had situations where for external reasons, the appointing party wanted to make a change mid-cycle, and the interpretation of the law made by the reviser of statutes is there was no mechanism to remove somebody unless they voluntarily resigned. So this changes that. People can now be removed by the person who appointed them and replaced.
One follow-up question, maybe a comment and then a question. I watched some of the committee meetings discussing our cabinet, and there was some fallacies shared or misinformation shared out there. And I was wondering if there's a better way that we as a cabinet could help I don't know, advocate for truth sharing.
Yeah.
It's very important that the committees make their decisions based on facts, not fiction.
While I'm processing appropriate response,
I'll jump in there with a thought.
Thank you.
Leetta, yes. And wouldn't that be lovely?
It would.
Also, I'd like to reiterate that I do think it is important for us as a cabinet to address some of those things following the completion of this process. While the end product has turned out to be overall a good product, and thanks to all those who just diligently work to make that happen, we do need to go back in and clear some of those things up. And I think direct communication from the cabinet ourselves is a good idea through our chair. I also want to follow up, and Melissa, I may have not heard this, but my understanding of Senator Erickson's motion to the conference committee report amendment is that all cabinet members will now be members of the legislature. If you are appointed by, so for example, I am appointed by the House Minority Leader. In the future, that position will always be a legislator. The House Minority member only can choose from currently serving legislative members. Is that correct?
Yes, and I can't believe I left that detail out. The legislative appointments must be sitting elected lawmakers. So in the past, they've had the flexibility. They have always had that option of choosing from within their own membership ranks, but they've also had the option of choosing from the general public, and often have chosen to appoint people with experience outside the legislature that they have felt mattered. The governor's appointments will continue to have that subject matter focus. She is not bound by that requirement. So we will be a board populated by 5 members of the public and 6 members of the legislature in the future. So, I did seek revisers' clarification. Unfortunately for a couple of you, July 1, 2024 will be the date that provision takes effect, where legislative appointments must be sitting legislators. And so
John, I know you were in the room when all this was happening. Was there some reasoning provided to support this as a best practice?
Yeah, well, yeah, I was in many rooms throughout the entire session as 96 was coming together, and there was reasoning given. And I should also say that I had individual conversations with members of the conference committee, and just so that everybody's fully aware of the conference committee, that is what happens when the House and Senate have differing opinions about the same piece of legislation, and they come together to work out any differences. And it's made up of 6 people, 3 from the House, 3 from the Senate. In this case, it was on the Senate side. Senator Renee Erickson was the chair of the conference committee, and she was joined by Senator Brenda Dietrich out of Topeka and Senator Usha Reddy out of Manhattan area. On the House side, it's Sean Tarwater, the chair of the Commerce Committee. And for this particular conference, it was Representative Tory Blue out of Great Bend, and then Representative Jason Probst out of Hutchinson. And so I had conversations with members of the committee about the value of having the option of non-elected officials being in these roles. And they said they would take it under consideration. I believe that it likely came up in public committee meetings was having electeds as the appointees gives greater oversight for the legislature and greater oversight of the budget itself, because there is a concern or a belief that the Children's Cabinet is making decisions that or maybe usurping the legislative authority of appropriating money or something like that. So, but there was no other reason that I heard of, because I did highlight the value of what if you wanted a parent with that lived expertise of being a parent to represent your position, or what if you wanted somebody from a particular geographic region, or what if the House or the Senate is completely void of anybody who cares deeply about early childhood? What do we do at that point? And also, what do we do if the partisanship that has trickled from DC that now finds its way in Kansas makes its way to a board that, for the most part, has been able to rise above political disagreements? So, I don't think it's a good idea to have exclusively elected officials as the appointees of the legislative leadership. And yet, if that is the case, which it is going to be the case, there are no other trains out of the station this year to change that. It means that we have an opportunity to focus on elected leaders who can become champions for kids. And while many of us, I imagine if you all are like me, you feel like you're preaching to the choir or you're getting preached to, you already know this stuff. So if the Children's Cabinet can be a place where more people can learn the value of this, then that's the lemonade that I will make out of this. But I do not think it is the best move. And I'm not trying to save my seat and keep one extra meeting on my calendar, just to be clear. This is trying to really think of what is best for children in Kansas.
Thank you, John and Monica, for your input on that. I would just point out a very real practical difficulty with having 6 elected legislative members on the cabinet. Senator Erickson couldn't be with us this morning because she has very important hands-on policy making responsibilities today. That is likely to occur in the future during the February and April meetings of the cabinet. So it creates a possibility that we would not be able to conduct business for lack of a quorum because the legislative members could not be present. So I agree with you. I think there's an opportunity there to expose more members of the legislature to the good work done by the cabinet, but that is a very real and very present risk that we may not be able to conduct business in February and April in the future if we're overlapping with the legislative calendar. Question for you, Melissa, regarding the vote for a chair. I assume that would be a vote that all members of the cabinet would be eligible, not just the 5 appointees by the governor. Would that be correct?
I don't believe there's any restriction on which appointments. It's just the cabinet board shall appoint the chair.
Okay, all right, and that's fine. I don't have any heartburn over that one way or the other. It's that will be the law once this is signed into law. So,
and just to reiterate, Don, unless the governor decides to rescind your appointment, you will remain the chair for the time being.
Sure. I do have one other concern about the legislation in its present form, and that is the possibility for a complete turnover among membership of the cabinet all at the same time. There's real and practical value in having staggered terms, and that's a common practice for boards and cabinets that play a role similar to what the Children's Cabinet does. And the reason, of course, is to have some institutional memory, some expertise on the board that carries over from time to time. And if you create a potential where the entire cabinet could be replaced at one time, you lose all of that. And that's a real concern to me, but we will live with the wisdom of the legislature and move ahead as it is.
I would just note that this is a process that can evolve. They can come back. There is undoubtedly going to need to be what's known as a trailer bill next year as we move our way through the transition process and the planning for the new office, the detail of the new statutory considerations, the requirements for childcare providers specifically. There's a lot of moving parts in this bill that evolved rapidly in the last week that I fully believe will require some cleanup, if you will. And so we do have an opportunity, you as a board have an opportunity to make your feelings known. I would encourage, I shared my concern for the potential for a complete turnover and post-election. It just feels like that is not healthy board governance for all the reasons you've outlined. That suggestion was not added, not retained, but I think there's room for further scrutiny on that provision.
One further point that I failed to make earlier, and this is from a personal perspective. I've been on the board since August. I'm still struggling to wrap my head around all of the different components of your mission. I'm still struggling to learn all the acronyms. It takes time. And if the entire cabinet is in the same position that I have been in since August, I honestly don't know how you function. It's a problem. It will be a problem.
You see, Dr. Smith has her hand up.
Dr. Smith.
Good morning, everyone. And I echo the comments and the sentiments that have been given thus far, because the concern that I have from just the work that I've done with children from a healthcare perspective is that oftentimes when there are opportunities, sometimes kids get put last with things that are going on. And I wouldn't want some of the work that some of the legislators need to be doing that's important, that it gets pushed off because then that continues to impact children. And I think that that's the thing that I put first and foremost as we're talking about this is, what are we doing doing for the children? How are we making sure that they are centered in our conversation, in our discussion? Everyone agrees that children are important, we need to support them, but when it comes down to, well, what are our actions? Do our actions meet and match those words that we say that we support the children? So I just would have the concerns that everyone has already brought up in terms of, would you lose that institutional memory? Would you lose that turnover where everyone is new and has to learn all of these things? And in learning all those things, I can see that people might pause and say, well, let's wait till we learn this stuff first before we move things forward. And then now it can be delays in helping the children that we're supposed to be supporting and helping. So I thank you all so much for the comments, but also for the transparency of sharing this information with us.
This is Delise. I have a quick two-part question. First part is, this is a bill, correct?
Yes.
Okay, so do we know who the originator of the bill is, and can we share that? I would think we could, since it's public knowledge. And then if we wish to give feedback, to whom would we provide that feedback to? How would we do that?
John, can you?
Yeah, I was trying to figure out the original bill sponsor of 96, but just the quick story is Senate Bill 96 last year was a different topic altogether. It was then it made it to the House. It was referred to the Senate Commerce Committee. It was gutted. So imagine selecting a Word document, highlighting all the text, deleting it. Then you put in the text of the child care deregulation bill from last year. Then they also added 2785, which is the Office of Early Childhood, after amending that to put the Office of Early Childhood under the Department of Commerce and do some other things, put that all together into a kind of a Frankenstein bill that passed out of the House Commerce Committee and then went to the floor. This is truncating a lot that went on. What ended up happening, though, was that bill was heavily amended after lots of negotiations to take out quite a bit of the bad things from my perspective, to revert the Office of Early Childhood back to what it was, so on and so forth. But driving at that point, once something gets to a conference committee, the drivers of the agenda of the conference committee are going to be those 6 people. But it starts with Senator Renee Erickson, who chairs that conference committee because the base bill was a Senate bill. And then her counterpart on the House side is Sean Tarwater out of Stillwell. So they certainly have conversations in public. They may also have conversations about amendments that might be coming, but the decision to make changes to the cabinet originated for the most part prior to conference committee and were clarified though in conference committee. And so I have noticed enhanced scrutiny of the Children's Cabinet this session, enhanced maybe a critique of or negative perception of how we conduct our work. And, I think it's probably time for more non-traditional voices who are on the cabinet or who are supporters of the cabinet to make themselves known, because as Melissa knows, as I know, perhaps Don, you know, you can only be a super senior for so long, and then people maybe still associate your prior persona with like they continue to associate your prior persona as a lawmaker with your current role, and that can sometimes be a problem. And so I think new and different messengers would be really valuable to help people understand things. But with where we are right now, there are very few options. So the House, as Melissa mentioned, the House passed the conference committee report for 96 last night at around 10 o'clock. The Senate has yet to take it up. So the options before them, there could be a motion. There'll be a motion to adopt the conference committee report on Senate Bill 96. If that fails, that kills the bill, and there is no child care bill this session at all. There
so
could
no
also
changes to the
no
cabinet.
changes to the cabinet, no Office of Early Childhood, no child independent care tax credit at 100% of the federal tax credit. All goes away. There could also be a substitute motion on the Senate side to not adopt the conference committee report and refer it back to conference, and a new conference committee be created. Today is the last day that conference committees can meet. And Renee, as the chair of that committee, is vice chair on like 2 other committees and chair of another committee. So practically speaking, her schedule is very complicated right now. And so they can run past midnight because they still consider that a calendar day in the legislature. But that is an impractical option to have this conference committee reconvene to potentially change things, because there are also other things of this bill that aren't ideal. But as we now see with the tax bill, I know you all aren't following it as closely because you're not as big of nerds as me. The tax bill was voted down in the House, the conference committee report, and they're not going to come back on the tax bill until veto session, and it may get worse. And that is always the fear of these things. It's always a gamble of you reopen it back up and it could get worse. So that was the second option. Or, again, the Senate concurs with adopts the conference committee report, then it heads to the governor, and then every one of us and those who have concerns about this gear up for a 2025 legislative effort to clean up anything that's technically needs to be cleaned up and potentially make changes to the statutes as it relates to the cabinet. Does that help, Delise?
Yes. And I don't do a lot of legislative stuff, so I'm following along carefully. So if I'm understanding right, it's gone through the House, it next goes to the Senate and then to the governor. So really there's not anything for us to do with the House because it's already cleared through the House. Next is Senate. And that feels like that's a tight deadline. So there's probably not much we can do there with the Senate. So then it goes to the governor's desk, and that would probably be the person that we would need to provide our input to.
Yeah, you can certainly provide input. Anybody can provide input right now. The challenge is a conference committee report is a different type of bill because it can't be amended. So all they could do is say yes or no to it. The place where edits to the language can be made are in the conference committee itself. Once the report is signed by all the members and put on the floor, it's yes or no. You might like 3/4 of it and hate 1/4 of it, but all a lawmaker do is vote yes or no. Same thing for the governor. She can only veto it. She can't.
Or sign it.
Or sign it, or let it become law without her signature.
And I will say at this stage of the game, there were John mentioned the intensity of the negotiations. I think the future of this bill is either the Senate goes ahead and takes its vote and sends it to the governor, or they don't. So if it goes to the governor, it's likely to get signed out of good faith in the negotiation process. So really the focus needs to be on assessing where we go from that status as we experience the changes and prepare for the 2025 legislative cycle. So yeah, there's not a lot of room today to affect any meaningful change in the process.
Delise, what I'm going to do is I have some pretty strong opinions about this, but John so masterfully explained it. This, in an ideal world, we would have had an opportunity to respond. We would have had an opportunity to be part of the conversation. And that conference committee doesn't support that kind of input and process. So what I'm resigned to doing is being an active part of elections this summer and fall. And then the second elections happen in November, contacting legislators that I know and saying, hey, do you have a minute to talk about the Children's Cabinet and the good work that it does? And that's kind of where I've landed in my mind at this red hot moment, because I really want this thing to pass for the structural reasons. I am concerned about these changes, very much so, and but I'm also gonna turn it over and be committed to making it better later on.
Thank you, Monica. That was also helpful. I appreciate all of that. So I will be one of those people that will be caught up in it because my appointing person is no longer part of the Senate. So you have my commitment that if someone will communicate with me outside of being a member of the cabinet about when and how those communication should be made to try to get things changed, I will absolutely do everything that I can to try to get word forward to people, because I'm very concerned about the way that this is going to play out for the Children's Cabinet and for ultimately the kids of Kansas.
I don't want
at John.
Yeah, so Delise, I'll just say, this is John Wilson. I'd be happy to follow up with you after this.
Thank you.
I don't want us to lose sight of the fact that this is, even though it's a flawed bill from the perspective of many of us, it still represents real progress. It represents, it puts in place that single point of contact for all stakeholders in the early childhood arena. It makes progress in terms of efficiency, in terms of effectiveness of delivering the programs. That's still in place. That's still part of this bill. We see practical difficulties with some of it, but it's a product of compromise, as most good legislation is. So let's celebrate the fact that progress is being made and continue to work to try to make it better in the future.
And Don, one last positive thought here. You know, I didn't understand this until I was over there. A lot of times in the legislature, you're just really hoping bad things don't happen. You kind of give up on good things happening. And this is indeed a good thing. And I'd also like to draw to folks' attention, because of very strong advocacy from a lot of partners and a lot of community-based folks who are probably listening today. You know, 2 weeks ago, we had a really bad bill. John nicely referred to it as Frankenstein bill, but it would have crushed childcare in Kansas as an industry. And so on the note of keeping bad things from happen, let's add that in, because we're not having that conversation today. So thanks to everybody out in the field and folks who are willing to go into the building and make that happen.
I appreciate the board discussion. I have given all the updates I have for you all. I will keep you updated via email as to the progress of the budget and the fate of this bill. So, you know, those of you who don't routinely make following the Kansas legislature your hobby will stay tuned into the steps in the process. I mentioned we will need a special meeting. Even if it's the same day as our cabinet meeting, it will need to be a separate meeting we'll open and conduct to organize our 501c3. So watch for that. I want to say one thing about process. There is suspicion that you as board members do not receive enough information from cabinet staff to make educated decisions. And I just want to publicly state that on top of everything we do provide for you, at any time, ever, that you have questions about the work we do, the proposals in your meeting preparation packages, 24/7, you can reach out and we will answer any question you have and provide whatever information you need. I try and make that clear in the emails I send with your prep materials, that questions are welcome, and that staff and I are here to make sure that when you arrive at our meetings, you feel equipped to take up the business on our agenda. And I trust that is the case. I trust the expertise you all bring to the process and have appreciated the fact that each and every one of you are willing to volunteer your time for this worthwhile work. So whatever happens, know that the relationships we have built and the work that we have done together is something that I think we should all be incredibly proud of. And so thank you. And then my final note, she didn't mention it in her agency update, but I want to recognize Amy Meek. Next week, on Friday, will be her last day as a member of our cabinet team. She's been with the cabinet for 9 years, so she was here 4 years before I was appointed to this position, and has been incredibly valuable member of the team that I have relied on in many, many different ways every day. So I just wanted to thank Amy for her work. We are losing Amy to the private sector, as so often happens when people work for state government, but we wish her well. And then final thing, and I know she really isn't going to want to be recognized, but last Friday was Dioga's 20th year with the Children's Cabinet, and I just want to celebrate her dedication to our work as well. Dioga's been in the employ of the Kansas state government for, I think, 35 years, but 20 of them, the last 20, have been serving the Children's Cabinet. So thank you both, and just appreciate the group that we have to work with here at the cabinet. Mr. Chair, that's all I have.
Okay, thank you, Melissa. And thank you both Amy and Dioga for your diligent support and work on behalf of the cabinet.
Yeah.
You're
Amen to that.
Yes, one
that's
clarification on the 501c3. Melissa and I have talked that most likely there will not be a need to have a special meeting prior to June. That would only happen if there was some urgency to getting the structure in place and going live, so to speak. That probably will not happen. And if it doesn't, we will piggyback onto the June meeting. But there's still a possibility that some event could take place that creates a situation where we want to speed it up. And if so, we will do that and make it as efficient and less demanding of your time as we possibly can. Any further comments by any of the cabinet members? If not,
Don, this is John.
Yes.
This is John. I just want to say that if folks were interested in kind of a status report of SB 96, that we have a blog update on our website at Kansas Action for Children. So you just go to kac.org, and in the top nav, there's a thing that says updates, and you can go to our blog. It provides a snapshot of where the bill is now. We also have the same thing for the budget, which is a massive undertaking to understand the budget. So we've synthesized it based on how the budget is impacting kids and families. So you'll see where funding for infant toddler services or whatever, baby steps funding, whatever it is. So that's also on our blog as well.
Thank you, John. That's a very valuable resource. Thank you for pointing that out.
Don, I just want to note the June meeting is it's a pretty extensive meeting agenda that we will receive the annual accountability report. We will make budget recommendations for fiscal year 26. So I think we can plan that it will take the full block of time and is a really important one for all of you to carve out time. I know I appreciate the intensity of juggling a 3-hour meeting with your regular professional lives, but I would be very appreciative of a full complement of cabinet members, and every last one of you will be a member of this cabinet until July 1st, 2024. And I want every minute of your time while we can benefit from your expertise. So just wanted to put a plug in for taking a look at calendars and trying to protect that Friday morning.
All right. Thank you, Melissa.
And Dawn, this is Leetta. Can I make 2 comments?
Sure.
Amy, wishing you well and wanted to tell you we will miss you. Thank you for all of the effort and work you've put in to making us so much better. It's quite different than when you joined us, right? So best wishes to you. And Dioga, congratulations on 20 years. And then 3 comments. I have to just brag on Melissa for her efforts. I bet, Melissa, you would say you've probably worked harder this legislative session than and others. I don't know. You've worked really hard in past legislative sessions as well, but I'm extremely proud of the professionalism and calm, cool collectedness that you've displayed, because quite frankly, I would have had a hard time remaining just, I don't know, passive, my face without it being like, what, are you crazy? It was some of the things that were said in committee meetings. So I appreciate you representing us well. And
Thank you.
I'm very grateful for that. Thank you very much. And Don, thanks for your leadership as well. Thanks, everybody.
Thank you. John, I see your hand up.
Yeah, I just want to make sure that as we update slides for the June board meeting, we will have another doctor among us. We have Dr. Leetta Felter, who recently completed her defended her dissertation. So we need to make sure that the slides reflect that.
Love
Thank
it.
you. That's so nice. And I have to say, I'm glad it's over with.
Congratulations.
Thank you so much.
Yes, indeed. Congratulations. Well, there being no further business to come before the cabinet, I declare the meeting adjourned, and we will see you in June. Thank you all.
Thank you.
Everyone have a great weekend.